emergency was declared for the US last week. The thing that I want to keep promoting is we cannot blame this on the LGBT community. And I think having done a couple news stories last week, I think we're not doing that. There's 5 children that are infected, 2 in Indiana, 1 in Illinois, and 2 in California. So I think it's very clear that this can infect anyone. However, men who have sex with men are a higher percentage of the cases right now, but a lot of that has to do that MSM population is very social. They have a lot of large gatherings and parties, and right now I'm seeing pictures of pool parties that scare me because it's body-to-body person standing there with no shirt on. And as you know, this is the most common way for it to be spread is from someone who has active lesions and body-to-body contact. There has been some suggestion and discussion that people that are very intimately close, that it may pass from respiratory secretions, but I haven't seen that confirmed. I've just heard that as a story. So I think we have to continue to be careful. And it is true, if you picked up a towel after somebody with monkeypox just used it, that's a risk. So we're learning more, and just as we did with COVID and with HIV back 40 years ago, it's a learning curve, and every virus is different. And so we have to continue to stay vigilant on what we're seeing in terms of transmission rates and where it's happening. We have been getting calls every day, and today we've just been completely inundated because we had put out a Facebook page last week saying that we were working with a company to develop a saliva test. So we're very, very busy. We've had 2 active cases in the practice. We've had 6, at least 6 that we know that have been exposed. And in fact, talking to the staff today, they've had 3 more patients this morning who were exposed. Challenge for us here, what we're hearing from these patients now, it isn't directly from the health department, but they're already out of the vaccine that they just got shipped on Tuesday of last week. So it's a high demand. They have to be a little selective now in not just giving people the vaccine who want it. It needs to be people that have been truly exposed or people who are positive. Most viruses, we do have saliva tests to detect antibody, and they're read in 15 minutes. Right now we have to send people, we're not even collecting samples at our office because it requires a little more specialty carrying the virus to the lab. So we're sending people directly to Quest or LabCorp if we think they're positive. If we had a saliva test, it would be much easier to diagnose the virus. And I think that it would certainly be a lot more comfortable for many laboratory staff. As you can imagine, they're concerned. We are finding that all people that are in that role are being vaccinated with priority so that they're a little more protected. The monkeypox was first discovered in 1958 in Africa, and it was discovered in monkeys. That's therefore monkeypox. It mutated to become a human virus and then became transmissible human to human. So we know that there is sort of a background incidence of monkeypox in Africa, and it was believed that someone visiting there brought it to the US. Obviously more than one person. It's not going to be one person starting an epidemic in the US. So we know that and therefore if it's left Africa, it's in other countries as well. The incubation period of this virus is 21 days. And people are coming in with fatigue, headache, and the first patient had a low-grade fever, the second one didn't, and then followed by the rash. And it does come up initially looking like a blister, and then the scabs are very prominent. There's a belief there won't be scarring as there was with the smallpox. This virus is very similar to the smallpox virus. So the hope is we won't be seeing scarring as these patients heal, and the lesions can take over 2 weeks to resolve. So there is a treatment. We don't know how much effectiveness it will have because it was still in clinical trials, called TPOXX. There are 17 million of doses of this particular treatment available, so they're not going to run out, and it's not going to be like the vaccine where we're so limited. We're having people, saying, I demand the vaccine. Well, unfortunately, when there's only a limited number and we're trying to treat people at greater risk first, someone who's in a monogamous relationship, for example. And we've had even heterosexual couples who are not even out and you know, having contact with other people saying, I demand the vaccine. So you have to understand we're limited, and the people who need it first are going to get it. Even in our practice, the HIV immunocompromised patient in our population are going to be priority. And then we have a number of patients that are on PrEP for HIV, and that is a group of people that need to really be careful. And the pre-exposure prophylaxis for HIV is very effective and being used very heavily. And I'm finding that some patients are probably more sexually active because of PrEP. So they need to be careful. It's the kind of thing that it is body-to-body contact. We just have to remember that.